Welcome to Millennium Counseling Center's podcast, where each week we go in depth into all things mental health, addiction recovery, and being our healthiest and happiest self. Enjoy. Okay, Derek. Well, we're back. It's been a little while, so I'm excited to be back on with you. And today we are extremely fortunate to have a guest.
Absolutely. Yeah, we have. I will let you introduce him, but we've known him for several years. Incredible guy and extremely intelligent, and has a lot of insight to some of the other ways for people to get effective treatment and do what we're all trying to do, which is help people get better in the world.
Absolutely. Absolutely. Yeah, we did meet Dr. Bonci a few years ago on a visit to Miami. And then over the last few years, they've opened up a center in Chicago and other places. But today we are joined by Dr. Bonci. So welcome.
Thank you, guys. It's a pleasure to be here. Thank you. And great to see you again.
And Dr. Bonci does have an accent. He is from Italy. So, he's a very interesting man. And we're actually really excited for him to be on. And we've known you for a while and have always been really intrigued by our conversation. So thanks for joining.
My pleasure, guys. Great to be here.
So the reason why we wanted you on is because you're an expert in TMS. So can you share with people what is TMS?
Absolutely, yes. That's my favorite topic of discussion.
Right.
So TMS stands for Transcranial Magnetic Stimulation. And it's a fantastic technology that is not even new. It's fairly old. Now it turns 40, as a matter of fact. The first study published on TMS was in 1985. And TMS is a brain stimulation non-invasive technology that was invented for depression. It was invented in the 80s for depression by a physicist, Dr. Anthony Barker in England, because we knew already back in the 80s that only about 35-ish% of people would respond to medications for depression, to antidepressants. So we knew back then, clinicians knew already that we needed more to help people with depression from the medical point of view. And so TMS was invented for that, to help people with medication-resistant depression. And since those early studies in the 1980s, now there have been more than 20,000 publications related to TMS and depression, TMS and anxiety, addictions, OCD, ADD, PTSD, early stage dementia, stroke, multiple sclerosis, and so on and so forth, schizophrenia. So TMS and the science of TMS has expanded dramatically in the last 40 years, with more and more studies showing how TMS can benefit a huge variety of conditions and symptoms. So it's a very exciting and expanding field of medicine right now.
When were you first introduced to TMS?
I had to know TMS back around 2010 when I was doing a study when I was scientific director at the NIH at NIDA. And we had a study trying to figure out what happens to the brain of rodents, rats, when they are addicted to cocaine. And what we observed was that the brain of rats that become addicted, quote unquote, to cocaine is very similar to what imaging studies and QEEG studies have shown to people. That the frontal cortex, which is the decision-making control center of our brain, reduces its activity as a consequence of becoming interested and addicted to cocaine. And so we did this study in rats showing that when we turn on the frontal cortex of rats who are addicted to cocaine, so we bring back online this brain region that has been slowed down in terms of brain activity by cocaine, these rats would lose interest in cocaine. So we thought right after that study that maybe we can stimulate and, so to speak, wake up the frontal cortex of people who had an addiction to cocaine by using this non-invasive technology called TMS. So I started paying attention to TMS when we had a reason to use it for patients. And we started actually clinical trials back in 2015 to help patients with severe cocaine addiction by using TMS. And we saw incredible results that within a few days of stimulation, these were patients who had more than 16 years of cocaine addiction. within a few days of TMS, these patients would begin to say, I don't crave cocaine anymore. I don't want it. Why was I using it? So the decision-making control center was coming back online and they were not interested in it anymore. So that's when I started thinking about TMS. And I confess I didn't know even that TMS existed until then, even if I'm a neurologist. As you know, I practice in Italy, but TMS came into my radar screen just
Yeah.
at the
So
time.
what happened? I mean, because now like you're an expert in the brain and you see this thing that's helping, you know, differently than other things. Like what's happening within you as you're kind of discovering this?
It has transformed my life. I have to say that the first 20, 30 patients that my collaborators in Italy were treating with severe cocaine addiction and TMS, first 20, 30 patients, when they called me and said, Anto, you need to see what's happening here with this TMS, I didn't believe them. And I wanted to go to see one by one all these patients because it seemed too simple to be true. And it seemed too good to be true. So I wanted to speak with all these patients. And what was incredible is that these patients came from every SES you can imagine, IQ, jobs. It didn't really matter. Every one of these patients was saying the same things. I don't crave it anymore. I don't want it anymore. I'm not interested anymore. And so then we kept on studying. We had actually a second study which analyzed more than 900 patients. This was a study that got actually TMS approved in Europe by the EMA for addictions. And time after time, since 2015, we kept on seeing the same results, whether it was cocaine or alcohol or pathological gambling or other types of addictions. It's still blowing me away when I have a patient, even now, we have many clinics, as you know, in the US or Italy, that says, Doctor, I don't know what's going on with me, but I don't crave it. I'm not interested anymore in alcohol, cocaine, gambling. It still, for a second, to be honest, it still surprises because our brain is so complicated. And yet, with these few minutes a day of stimulation in this region, you see people changing, becoming aware of their addictions and becoming distant from the cravings, from those decisions. It still blows my mind, I have to say. I'm not getting used to it.
Yeah. So I'm curious, how has your treatment of it, or is TMS all the same, or have you learned through the thousands of clients that you've seen, patients you've seen, like is it just one way, or is it lots of different ways that TMS can be administered, or like how is it evolving for you?
This is actually a great, great question. TMS is not the same for two people in a sense that we do have guidelines. We know which brain regions have to be stimulated. We know which machines can do what. There are navigation systems, for example, but the frequency, the intensity, the duration of the stimulation, how many minutes, and the location, those are very up close and personal, and they can determine basically success or failure of treatment. This is why, I compare TMS in a sense to a surgery. It really depends on the surgeon. It depends on so many different factors that you learn by experience. If I think back on our first patients and what we knew back then and what we know now, again, in terms of for how long, which frequencies, and where to stimulate, things have changed. We have learned an incredible amount of information time after time after time. So it really requires a lot of knowledge, which is one of the main weaknesses of TMS, right? Sometimes we hear patients say, sure, I've done TMS or I've heard somebody doing TMS, but it didn't work, right? And there may be many reasons for that, right? So the bottom line is that TMS should only be done in places, and there are some amazing places. Harvard, Stanford, Mayo, Johns Hopkins, Northwestern, UCLA, UCSF, and so on. There are some amazing places where they do incredible research on TMS and so on. But there are also lots of places where to be honest, I have no idea what they're doing or how much they know about TMS, which
So it sounds like there's a research component that is connected to the effectiveness of the treatment.
There is an experience component, yes. So those amazing universities I mentioned, they have tremendous amount of experience. They do beautiful research. There are places like our place that have treated thousands and thousands of patients. And then, of course, there are maybe places that just opened up and maybe they've trained a technician for a day or two or three. And we train technicians for very long periods of time, both theory and practice. So that will determine whether a clinic is, for example, for depression, 40% success rate or 90% success. That really depends on the experience, knowledge, and experience of the clinic. So TMS is highly dependent on that, which is very different from medications, right? Medications, 20 milligrams of Prozac are 20 milligrams of Prozac, but it's in a sense much more similar to what you do. I mean, therapy heavily depends on your knowledge and experience. And as you know, some people say, sadly, even my patients in Italy, I don't believe in psychology or I don't believe in therapy, but sadly, was their experience with that particular therapist that was unfortunate, right? But when they're treated by you, as we know, your success rate is fantastic. So you change completely the outcome, as knowing how to do TMS changes completely the outcome.
It sounds to me like, and this is what I know having worked with you all, is that and I think this addresses an overall problem in this space, is that I think a lot of people think there's problem A, so the solution is B, right? And I think that what we've learned is that we really have to have treatment models specialized and individualized to each person. And you have to have a lot of experience and understand it to know when to shift, when to go a little right or a little left. And I think that I guess the term I always use kind of in therapy is like kind of tweaking for the person, right? Like the general concepts might be overall the same, but the real value is in the ability to kind of shift from that based on how the person is doing, what you've seen, all the years and thousands of people you've treated. So being able to have everybody kind of has their own unique experience. It's not just one program that everybody comes in and does that. It's the ability to kind of maneuver within that, and you need to be very good to be able to do that.
Absolutely, yes, 100%. Because as we know, the diagnosis, even within the domain of trauma, depression, anxiety, addictions, there are a lot of variations, a lot of variables that determine that life, that person, those features. So they get to come into play even when my teams, whatever they are, decide what is the proper TMS treatment and what are the therapies associated with that, whether it's EMDR, whether it's DBT, IOP, PHP. So many different factors get the therapy for a certain patient very personalized, which is why you may have a high chance of success as opposed to, sure, let's just do this protocol, this TMS, and that doesn't usually. So absolutely, that's very personal and very specific.
Well, speaking of personalization, a lot of people know about psychiatry, right? We're a country that consumes psychiatry and medication to help with mental health. When is TMS recommended for that compared to maybe what more people know traditionally with anxiety or depression medications or other things kind of in the management of those symptoms and how those two kind of are kind of trying to achieve similar things, but when is TMS kind of the right fit?
Right. So people are becoming, first of all, I'm glad to say that more and more aware of the existence of TMS. We have a lot of people calling to say, hey, I have heard of TMS. Can you tell me what it does? Because I have depression, for example, or severe anxiety. But usually people show up for TMS after they failed medications, which, as I mentioned, medications for depression usually work in about, based on studies, 35%. But also we have a lot of patients, a lot of people that say, I don't want to take medications. I want to go straight to TMS. From a reimbursement point of view, which is important to know, back in the days, insurances would require patients to try 4 medications at maximum doses before TMS for depression could be approved, which was not okay. But now most insurances are okay with just a couple of medications. And so the process is becoming easier for people to have access to TMS, which is good. And then a lot of other people just, as I said, show up and say, I don't want to take medications. I want to go straight to TMS. So the knowledge of people and the awareness about TMS is changing. But I noticed that I just came back from the Clinical TMS Society in San Diego. The meeting was just a 200 people, tiny meeting until 3, 4 years ago. And now there were more than 1,000 people, and TMS is exploding everywhere, which is good. But again, it can be bad because I've seen some machines that are like a fraction of the cost of the real machines that are produced by other companies. But people that are not fully aware of the differences between TMS now may just buy this cheaper machine. So you are beginning to see TMS clinics everywhere, which is good in a sense, but then the quality control again is the issue that we have to be aware of.
So it seems like an education is what TMS is and then what effective TMS is.
Correct.
Yeah.
Correct.
Okay.
For example, some machines do require navigation systems in a sense that when you plug the TMS machine per se to these navigation systems, chances of being on target in whatever brain region you have to stimulate are more than by 50% more higher as opposed to not having a navigation system. So if I don't have navigation systems, studies have shown that 50% of the time I'm off target. If I am off target from the brain region I need to stimulate, my success rate drops. So there are a lot of details that of course people wouldn't know. And sometimes even companies that buy TMS machines are not fully aware of the importance of obsessive details to make TMS successful. So a lot of education.
One thing I wanted to ask you is, so it sounds like that based on whatever symptoms the person's feeling or whatever their diagnosis is, that where you are targeting in the brain is different for, I'm sure it's somewhat similar sometimes, but it's different. And I think that one of the things that I've heard from people who seem to have really good success rates in TMS is the abilities, whether it's the machine or the technician, to be able to really target those things properly and make sure that you're treating the right area to get the results that you're looking for based on the symptoms that the person's having or the diagnosis that they have.
100%. 100%. That is why it's crucial to have the correct diagnosis, because based on the correct diagnosis, the clinicians can really target which brain region, how many minutes, what would be the right intensity of stimulation, and what would be the right frequency. These are all factors that get computed into that person and nobody else. So that is absolutely crucial. One thing that I didn't mention, but thank you for saying that, is that, for example, people with depression, studies have shown, lots of studies, and addictions as well, that there is a slowing down of this brain region called the dorsolateral prefrontal cortex. But people with anxiety or OCD or ADD or PTSD or insomnia have other brain regions. One of them is called supplemental motor area that go too fast. It's like a heart beating too fast if I'm anxious, part of my brain, versus another brain region beating too slow if I have depression. So TMS has frequencies which are very precise to rebalance a sort of sense of like a pacemaker, brain regions that go either too slow, like depression or addictions, or too fast, like anxiety, OCD, ADD, PTSD. So the frequency chosen is crucial. The duration of the stimulation has to be tailored to that patient. The intensity of stimulation. These are not completely standardized, right? They really depend on how many of these 20,000 studies people have read, how much do you know, what is your experience? And that really makes a huge difference in terms of success or not for TMS. But this information is not in a manual anywhere. You need to create it day by day, patient by patient, year by year. And then eventually you have this knowledge that really enables you to get 100% out of TMS for every single patient, whatever that may be.
I know this may be unfair to compare because maybe these are not comparable things, but when you see a psychiatrist, you get on medication, that could be for the rest of your life. What is the length of time of treatment for a TMS? Because I think sometimes when people get on medicine, it's, you know, oh, it's only going to be a short amount of time, or oh, I realize this could be for 5 years or for longer, whatever it is. Like, is TMS like the rest of your life? Like, how do we think about the time frame of the commitment for TMS? And again, like before, like I don't want if it's comparing them in the right way of thinking about it because they're both treating mental health. But I think people may be more used to this idea or concept of the longevity of the need for a thing. And so I'm just curious, just with TMS, what is that like?
So TMS, also the field of duration of treatments of TMS is evolving as we speak. And I'll mention it. That's a great point. Usually TMS is done daily, at least for the first 4 weeks. And the gold standard for now, for example, for depression is 36 sessions. So depends on insurances as well, but they're usually done on a daily basis. So it's a daily commitment. Patients have to show up, even if it's just for a few minutes a day, 10, 20 minutes, but they have to show up every day, which is a major physical commitment because you have to go to the clinic to do TMS. But now there is a huge wave of accelerated TMS protocols. For example, there is a great protocol by Stanford University that was developed just a few years ago for depression only, that it showed that depression could be treated with positive results by doing TMS 5 days, 10 times a day. That is very intensive. It's in a hospital setting, but also Brainsway, the company that we are working with, has shown that just now, a few days ago, that also just in an outpatient setting, in 6 days, 6 sessions per day, they have improvement of depressive symptoms, basically in 70+% of patients. So the old and classic TMS treatment protocols are lasting several weeks. We have seen patients coming to us for 4 weeks, but still the gold standard is 36 sessions over several weeks. But now there is a huge wave of trying to make TMS more accessible to busy people. So the example of the Brainsway protocol, just 6 days, 6 times a week for depression, is a perfect example of where the field is going. We're trying wherever possible to speed up things because people are busy and not everybody can show up 36 times over several weeks. So that was and is one of the major obstacles, I think, for many people to have access to TMS because it's a major commitment. But there's something very important to say. I want people to know what do we know based on science on what TMS does to our brain, because I haven't touched on that. So every time that we do TMS, I mentioned that pacemaker-like effect to rebalance brain activity, but TMS does much more than that. TMS has anti-inflammatory effects. It reduces brain inflammation. It reduces molecules related to inflammation. That's very important in terms of longevity, in terms of anti-aging. Studies on early stage dementia show that TMS can be very effective for that. Probably the anti-inflammatory effect is very, very important because inflammation is the first step in many neurological diseases before we lose brain cells and they die. TMS produces brain plasticity, like your therapy. When you do therapy with your patients, you produce brain plasticity. And TMS produces new brain connections, brain plasticity. TMS increases brain blood flow and oxygenation, very important in a variety of situations. Again, neurodegenerative diseases is a perfect example. And TMS releases a lot of chemicals, dopamine, serotonin, our own neurotransmitters. So every time that we do TMS, we have these major but different changes to our brain that this is why it's like rebalancing our brain activity and rebalancing our brain chemistry at the same time. So this is why the repetition over and over and over is needed. If my brain has been struggling with depression or anxiety or addictions for many years, those highways, those brain networks don't get changed and rebalanced back to what they used to be in one day. The repetition of TMS is meant to really very gently rewire through brain plasticity and through rebalancing brain chemistry these highways in our brain that got used to being anxious or depressed or traumatized or addicted to something. So the repetition is essential. So far, this is why also the accelerated TMS protocols. Stanford does 50 stimulations in 5 days. BrainSwitch suggests the 36 stimulations, but in 6 days. So the number of stimulation is still high. And finally, when people finish their TMS treatment, whether it's those 36 classical sessions, then some people never come back. They say, we try to stay in touch with all the patients as much as we can. Some patients never come back, and some other patients do come back for the booster sessions. Life happens. I'm changing jobs, I'm divorcing, I'm going through a rough time. I will go back to do a few TMS sessions. Like patients come back to therapy whenever life happens. So that is unpredictable. But usually our experience is that when people go through a hard time, they will just raise their hand and say, hey, I want to come back for a few TMS sessions. So that is what we usually see. But some people never come back and they say, or I get postcards for Christmas. They say, it's been now 9 years, 10 years, and I'm still great. So it's a mix, as you can imagine, based on the life of the patient.
Well, I guess in the lead up to that, like years or decades of medicine versus a month of treatment seems like a very large difference. What are and I think one of the reasons why people struggle with medication is side effects. So how do you conceptualize side effects of TMS? Like what's it important to know?
Right. The side effects of TMS are in line with what TMS does. So the most common side effects nowadays are headaches initially. So the first week, probably the theory is that headaches can happen initially, 10-15% of patients because of this increase in brain blood flow, which is vasodilation, that we think is the main trigger for headaches, which people say, I don't care. I'd rather get rid of depression, anxiety, and addictions and keep a few headaches. The other most common side effects are some people feel discomfort. The sensation of TMS is like a AAA battery kind of electric feeling tapping on your forehead or on your head, which for the majority of people is nothing. It's not painful. It's not supposed to be painful, but it can be uncomfortable to some people. Very anxious people initially are anxious about, oh my God, what's happening to me? We really explain that TMS has nothing to do with ECT or so. And so some people feel dizzy or anxious initially, but those are the most common side effects. In fact, the only people that cannot do TMS are people who have epilepsy, people that have metal in their heads or less than like 8-9 inches from the area of stimulation, or cochlear implants, anything metal like close to the stimulation. Of people with brain aneurysms or like vascular malformation in their head, and patients who are acutely intoxicated with alcohol or cocaine or anything, because that could trigger seizures. But, those are in general the only patients. There are even studies on pregnant women, second, third trimester, showing that TMS is safe. There are studies on adolescents, there are studies on autism and children. I mean, TMS, as far as I can see, for example, in my clinics in Italy, we have a range of patients from the age of 10 to the age of 95. One is for Alzheimer's, the others are for symptoms of autism. So TMS is really, in general, very safe. And clinicians always collect a checklist of, making sure that the patient is a candidate before they start TMS. But those are usually the only reasons why people cannot do TMS.
Well, I don't know about you, Derek, but my clients coming in on medication are talking about way different side effects to drugs. Whether it's sexual stuff, weight gain, sleeplessness, not just like a mild, or like a headache that goes away. So again, that's kind of an interesting kind of like parallel, right? Where that side effect of the treatments, the duration is shorter and the side effects are dramatically like less. What do you hear from clients, Derek, around like why people would pick TMS versus medication? Because obviously you have a lot of experience with clients going through this.
Yeah, I think that, as we touched on before, this is a really complicated thing that people are dealing with, right? We're dealing with the brain and mood and thought patterns and behavioral patterns. And so I think that yes, there are many medications, there's side effects. I think the key, in my opinion, is that some combination of therapy and TMS, or therapy, TMS, and medication, or what some combination of these has shown, greater success rates. And that I think that in some way, as a person who thinks in numbers, I think everything that you're doing to try to help the problem is increasing your odds of actually getting better. So if you're somebody who, goes to therapy, you have a better chance than if you just try to figure it out on your own. If you go to therapy and TMS, then you have a better chance than if you do, just go to therapy. And I think that and that medication is in that mix, right? And so, but it's not perfect, right? We don't have the exact answer for every person, and so I think it's really important that that if you're getting treatment for this, you work with people who understand that. You understand that there's a wide variation of what may work for who. And I think that I think TMS becoming more well known and more popular, and in my personal experience with working with clients with GIA has been fantastic. It has been, like, anecdotally, it has been extremely successful. And so over the years, I've had people who have worked with TMS. I didn't necessarily know the folks they were working with. I don't know what type of protocols they use. But I wouldn't say that coming into kind of initially meeting Dr. Bonci that I certainly didn't think TMS was bad, but I wouldn't say that it was something that I had a lot of faith in, that it was actually going to help a treatment system. But in my experience in working with clients who have very complicated situations and complicated backgrounds, and who have typically done a lot of work and tried a lot of different things, that I have seen the addition of TMS, as well as the work they're doing with us, has pushed the needle and changed the response. It has changed the treatment of that person significantly enough to where I absolutely would recommend it for people at this point, which wasn't true prior to having my own personal experience, even though I had heard it can be helpful, just actually seeing people who are, I mean, I think I've said this before, but the way I look at it is, you have some people who come in and they try everything. They really want to get better. And so they engage in therapy and they follow their medications, and they don't put other substances in their body. And life gets better, but it doesn't get better enough, right? Life was a 1 or a 2, and it gets to a 4 or a 5. But they're doing everything and they don't understand, why can't I feel good? Well, it's great that I don't feel bad anymore, but why can't I feel good? And I think that is an area of significance that I've seen TMS really help with, is I have these folks who have been doing everything to try to follow what the professionals are telling them. And then TMS seems to be able to push them over that threshold and push them over that bump. So instead of living life at a 4 or 5 or 6, then they're reporting that life is a 7 or an 8 or a 9. And to me, that is how we have true long-term treatment. Is, I think we can reduce the consequences of whatever's going on in our life. But if we can't get to a place where we really feel good about the way we're living our life, then that the idea of going back to where we were is always going to be sitting in there. And I think but once that changes, people don't want to give up living life at an 8 or a 9, right? So if that means I go back to TMS for a booster, if it means I still, see my therapist once in a while, if I decide to stay on a medication, any of those things, that really keeps people in a good place, right? And so I think, yeah, my experience with TMS has been fantastic.
You brought up about counseling. Dr. Bonci, how does TMS and counseling, what happens when you merge the two, right? You talked about all the success. You talked about, like, the short amount of time, then traditional medication, the short, the really shrunken kind of side effects. But if you bring along counseling for the ride, like, what have you seen, and what's the benefit there?
We have seen back from the early days of the first clinical trials that is essential, because we had also obviously experiences initially of patients that said, sure, I have an addiction to alcohol, cocaine, but I don't want to do anything else but TMS. And it didn't work, in a sense that TMS in those patients was able very temporarily to reduce cravings, and the usual improvements of TMS, cravings and depression was improved and so on. But if you don't go deep into why was this patient drinking alcohol, for example, or whatever the addiction was, all the addictions bounced back. So clearly, we learned that initially we don't accept patients that are not willing to do a multidisciplinary program whenever that is recommended for them, because TMS doesn't give you answers. In a sense, TMS is very stupid. It doesn't tell you why. A lot of people have trauma. A lot of people have addictions and depression and anxiety because of environmental situations, and TMS doesn't give you answers. But TMS, on the contrary, allows therapists such as you to dig deeper with patients. And we have heard that over and over and over, because patients, when they also do TMS with therapy, they become more present. Many cases, they become way more compliant, more introspective. So, as you were saying before, Derek, TMS is needed in combination with, because the few people that tried in the early days, again, to just do TMS to take care of their addiction, it's a temporary band-aid, but it doesn't last, because it doesn't give you answers that you absolutely need. And it doesn't give you behavioral strategies that you need to not repeat the same behavior. So absolutely. And there are a lot of studies on that, even scientific studies showing when TMS is done in combination with therapy, absolutely much higher, way more significant outcome and much better success.
I think that's what originally really intrigued us about this, is that one is that it opens up pathways to be able to do the deeper work, right? It makes that possible to stimulate those parts of the brains. But I think also, as you mentioned, one of the, barriers to TMS can sometimes be the frequency and the daily work. And, for our intensive 3A program, it is built around daily work, right? It's built around daily one-on-one work. That's what our program is set up to do. And so the combination of, and it's one of the reasons why we thought it was important to be in close proximity with the work you're doing, because what a great way for something that is such a difficult thing to treat. And then you can come and you can do the therapy, you can do the TMS. Those things are very close to each other. And like I said, from an outcome standpoint, we have absolutely seen that the combination of those two gives you a better chance of getting healthy than either one of those alone. And so anytime you can figure out how to combine those, make it somewhat convenient, and kind of be able to do all of these things in one general area or same building, then that makes everybody's access to treatment much better, makes it more possible, because you don't have to take off two different times during a day, right? You can come, you can do your work with us in the 3A, and you can go then follow that up with the TMS, and it's all very close to each other. So I think that's one of the things that really intrigued us. Obviously, the outcomes and what we've seen with people, but I would say that my personal experience is that it has been more helpful than I was very excited about it when we first started talking with you all, but it has been more helpful than I had expected or hoped. So that is exciting to me, because for all of us, we're just trying to help people get better, get healthy, and any ways we can do that, I think we all need to explore.
So Derek mentioned treatment at the same time in the same building. Might make sense to talk about why that's the case. Can you share a little bit about GIA healthcare and what that is? That way, people can understand what that means in terms of, like, people might know what Millennium is, but what is GIA healthcare, and how do you guys work, and where are you guys?
Absolutely. So GIA Healthcare is a group of clinics in the United States. We have the sister clinics, which are identical in Europe as well. They are called Brain and Care in Europe, GIA Healthcare in the USA. And we are here in Chicago, just next to you, just upstairs. And we are in Newport Beach, and in Florida. We have 5 locations in Florida. We are also very keen on free education. So anybody who calls and wants to learn about TMS, it's zero cost. We can spend 30 minutes, we can spend an hour with them, and we tell them everything we know about the science of TMS, so that people can get a better idea before they commit to do TMS. So that's crucial to say, because a lot of people say, okay, but I don't want to commit, or I don't want to give my credit card. Of course, it's free. So people can reach out to us, and we are basically treating the majority of the patients that we see fall into the situations and conditions that I mentioned before, whether it's depression, which has been FDA approved for a long time now, whether it's depression, OCD, or addictions, or PTSD, or anxiety, or ADD. Those are, I would say, the 5, 6 diagnoses that we see here in Chicago most frequently. And anybody who's curious to learn anything they want to know about TMS, we can send them references and articles and literature. They can just call us and they can have a tour of the clinic. It's free. We can have these long conversations in person or via video so that they get free education about TMS. And we do that every day, whether it's here in Chicago, which is my favorite city in the United States, as you know, with San Francisco, and or whether it's in Florida or in California. We love to just give access to people on TMS, and then they will decide if they want to incorporate that into their treatment. So that's who we are, GI Healthcare.
And I just thank you for spending the time and educating us a little bit and everyone else around TMS. And grateful that in 2010, you got the experience of studying those rodents about the brains, because, all of the amazing work you've done since then is just amazing. So thanks for being here, and I really appreciate it.
Thank you, guys. Thank you. Very grateful.
Appreciate having you here. Keep doing what you're doing, helping all these people.
And you too, guys. You're doing amazing.
Appreciate it.
Thank you, guys.